Good morning and welcome everyone to our May 20th, 2025 Board of County Commissioners 9 a.m. board briefing meeting. Let the record reflect that we have four commissioners that are present: Commissioner Kearns, Commissioner Waldrop, Commissioner Jordan, Commissioner Cuny. Commissioner French is away on county business. And so we have a busy morning. So we're going to go after yesterday's mornings. We're going to get started because you never know what happens. So, Chief Ellis.
Morning.
Good morning.
Dave Ellis, Spokane Valley Police Chief and Undersheriff of Spokane County. Coming before you with two agreements for consideration. The first one is a renewal with a company called Reco. It is a helicopter detection device that's used for search and rescue. It basically emits a signal for avalanche victims, and it basically the clothing that is utilized by the victim sends out a signal. So when the victim is trapped under snow in an avalanche situation, we're able to detect them and hopefully get them saved and that kind of stuff. So this is a renewal. It's been reviewed by legal and there's no cost impact.
Questions? No, seems like a good thing, as I know.
Yep.
Yeah.
Absolutely. The next one is with a company called Drone Tag. It is for a 2-week trial period for us to test and evaluate this product. It is a product used to detect drone activity. And so if we have a situation where someone is flying a drone potentially illegally or in a harassing manner, this would allow us to be able to detect that drone and be able to track it back to where the operator is flying it from. There's no cost on this. It's just a 2-week test and evaluate period, see if it is technology that we might want to consider in the future. And I believe this has also been reviewed by legal. It's for the indemnification portion of it, and available for any questions on it.
So what happens at the end of 2 weeks if you really like it?
So if we decide that we like it, that the product costs, I think it's $1,100. So we'd evaluate it and see if that fits within our budget.
Like a couple of years ago, I mean, there were tons of reports, people flying drones around airports and stuff where they should, I mean, does that still happen a lot?
There's still some, yeah. I mean, we kind of get the range of it. I mean, a lot of what we're dealing with is, someone saying, hey, my neighbor's flying over my house and harassing me and that kind of stuff. So, I mean, that's part of it. And then the other part is just, potential, terrorism events and that kind of stuff at major, sporting events. We will have it during Hoop Fest weekend. And so, we haven't seen anything like that in Spokane, but in other places where they are using drones for, either deliver an IED or, deliver drugs into a jail, prison facility, things like that. So it's a chance to kind of evaluate, see if it's effective, if it works, and see if that's something that, works, for a future big event or kind of deal with the neighborhood nuisance issues as well.
I think it's going to be drones are just becoming more and more popular all the time. So yeah, I think having that ability to see, I think we saw during Camp Hope that when the sheriffs or the Spokane police would put up a drone and someone from inside would put up a drone and try to knock it out.
Yeah, I believe they actually knocked one out. Yeah.
So interesting. Okay. Any other questions? Okay. Thank you.
All right. I appreciate it. Thank you.
You're off the hook. Not a captain.
All right, good morning. I just have 2 items for you. The first one's an agreement with the Criminal Justice Training Commission. This is for Director Anderman, who's the director of the training center. Last year, we entered into a contract with them because they utilized them for curriculum development for the basic law enforcement academy and then other statewide law enforcement training. They reimburse us up to 50%, or actually total of 50% of the salary, which is about $96,765 plus benefits. The agreement is from March 1st all the way to 2025 to February 28th of 2026. It's been a little late coming because of the new contract process that CJTC has, so that's why it's getting a little past the due date. But there was some indemnification language in there, but other than that, it's just a straight reimbursement for salary.
It's like
Tony Anderman, yeah. He spends about 50% of his time over in Burien working on curriculum, and They actually, the whole rewrite of the basic law enforcement academy was all his development, and so it's rolled out statewide, all the academies now. So it's been pretty effective, and what makes law enforcement better law enforcement training for the state's better for us too. So we use this money to reimburse or to pay the assistant director, Steve Barbieri, to kind of run the facility when he's gone. So
Because they're buddies over
yes,
there.
yes.
Great to have a sheriff's office employee over there helping guide it.
That has helped.
So I guess I'm not tracking. So we're going to fund that for him to develop the state's training?
Well, he does curriculum development, but like I said, he spends about 50% of his time over there, and they pay us for the 50% of the time he's over there for his entire salary, so.
Okay,
So it's not costing us anything to have him over there. It's the same as if we were paying him fully. And then we get reimbursed 50% of his salary, and then we use that to pay for his assistant, his deputy director. So
okay. So,
overall, the budget's exactly the same.
Yeah.
If he were just full-time and we didn't have an assistant, but
okay,
and we see it as an advantage because we get the benefit of the curriculum, and we get the benefit of the better trained basic law enforcement officers as well. So
okay,
I know it's
I wasn't making the connection. I guess I wasn't making the connection that he currently he's a Spokane County employee.
Yes.
Okay, I guess,
Yes.
okay, I would think
He's
he,
got these tall, lanky glasses.
He's got those, yeah.
Been in here
Yeah, he's-
recently.
Then we did that sleep thing.
Yeah.
Went over there to the.
over at WSU.
training.
Yeah.
Yeah, he was the
Okay,
tall guy.
okay. That wasn't clicking that I was thinking we were paying some state employee to do the state's curriculum. I was like, okay, I don't.
And that would make sense. You would have questions about that. Like maybe I should have.
He works He works
He is
here.
our employee.
Got it.
Yeah.
Okay,
But
got
he's
it.
seen as such an expert because they want him helping
Yeah.
to do it. And, it's great for us to have one of our own employees helping drive the curriculum.
He has revamped the entire curriculum at the Basic Law Enforcement Academy. It's completely different than it was 2 years
It's a
ago.
skill.
Yeah.
It's like, yeah, an innate skill you
And-
have.
And hopefully that will have the, for our advantage, it'll have the impact of reducing our post academy, and it has by several weeks, but we want to reduce it by even more. And so that'll save us training dollars and hours for when they come out of the basic law enforcement academy. We used to train them for 8 weeks after that. So that's another 8 weeks that they're not out learning how to be on the road. And I think we reduced it. It's either 6 or 4 weeks. So we reduced it quite a bit already. And so the better we can do upfront, the better we can do at the back end and get them on the road faster.
When I was just out at the sheriff's training center and talking to Steve, and he was talking about, even just on the front end, the training you
Yes.
guys are doing to ensure that people are willing to stay in the system.
Yeah.
Instead of spending a year in training and then they figure out they don't like it and can't handle it.
It's when I, 22 years ago when I started, I never thought I'd be that guy, but 22 years ago when I started, they hired me and I went to the academy the next day. And I got back and I had a week of post academy, and then I was out on the road learning how to do it. So we're a lot different than we used to.
It worked for you. Why change the? It's
I'll-
working.
I like to say that some people would succeed no matter what you gave them, but yeah. Any further questions on that one? All right, the next one is, so when we do search warrants or for DUIs or other blood search warrants where we have to draw blood, there's this thing called a legal blood draw, and traditionally we've done them with the jail at times or with AMR has done them, the hospital's done them. Well, everyone's walking back from doing them unless you have a contract. And so Providence has offered us this contract for the legal blood draws. As you can see, it's pretty low cost. It's basically a reimbursement of $13.24 per blood draw. And I was asking the traffic unit how many times we've used Providence in the last year or so, and they thought it was like 5. So it's just not going to be a very big expense. And so this is a 1-year contract for them to do our legal blood draws for us for $13.24 a draw. and there's indemnification language in it. We are working on a program to train our deputies as phlebotomists, and the city is doing the same thing with their police officers. And we have, they actually bought an evidence refrigerator and are installing it in the basement of the PSB. And so probably we need this contract in a while because we'll be able to do it ourselves, but that's kind of in the works.
So just like a little,
No, it's a full blood draw from the arm.
You're gonna have
and
your
several
officers
vials. That's a lot of agencies are going to that because if you're dealing with someone who's not cooperative or for whatever reason, having a nurse tech or somebody do it at the hospital can be kind of dangerous sometimes. So it's easier to have law enforcement do it.
1324 seems wildly cheap.
Yeah.
You can't put a Band-Aid at a hospital for that.
Can't get that data.
Right. I mean, that's shocking that it's,
I think they said it's their,
I'm surprised it's not 10 times.
they said it's their Medicaid or Medicare reimbursement rate or something like that.
And if they're listening, if it is 10 times that, we're not gonna pay 10 times. So
I thought it was, when they first reached out to me saying we needed a contract, I kind of rolled my eyes and said, uh-oh, and then when they sent me the numbers, I go, oh.
okay, well, I'm one of those people who's a really hard blood draw person.
Oh, yeah, me too.
So I just can't imagine you guys doing that, but
That's what we're working for.
okay.
And that's all I have.
Okay, we're gonna be ahead of schedule
Oh,
here.
yeah.
Look at you guys.
You could bring us more contracts at $13.
Oh, that's, no cost for $13 at work.
Like Kevin,
It
yeah,
goes all day long for you.
exactly.
Thank you.
Thank you. I don't know if Leanne's here.
She is.
Oh, she is.
Just-
Oh, she is. Hey, come on up, Leanne.
Gina's tracking us being ahead of schedule.
Right. Awesome. And if we need a break for this link, because we can do this lane.
Justin's team is all.
Good morning.
Good morning, and thank you for having me. Appreciate that.
Thanks for being here.
I wanted to, do you want me to just go ahead and?
Yeah, just go ahead and
Okay.
get started.
Wanted to give you an update. We have our CTR plan update, that is before you. And we're just looking for approval of that. So I just wanted to kind of go through what the CTR plan was. We'll go to the next slide. Thank you. Okay, so again, it's an update. The plan will run from 2025 to 2029. And we'll go to the next slide. Thank you. So all affected jurisdictions within Spokane County and their agencies were tasked to update the CTR plan again for 25 through 2029. It was a collaboration through our office, Spokane Regional Transportation Council, Spokane Transit, of course, Spokane County, and then the other jurisdictions that are also updating their plans as well. Next slide. So just a little bit of an overview. I know that you all know about the commute to production law, but it was passed in 1991, updated in 2006, and the statewide goals are to reduce traffic congestion, air pollution, fuel consumption. So the CTR update is part of the law. Next slide. So counties with urban growth areas such as Spokane County are affected by the law. Employers with over 100 employees that work between 6 and 9 a.m. and work at least 35 hours are affected by the law. And currently we have 96 employers that are affected by the law. So it applies to all public and private employers, and then also applies to the jurisdictions as well. So the cities like Medical Lake, Genie, all of those are also affected as well, whether they have the 100 employees. So next slide. So here, this is the jurisdictions that are affected. And you can see how many work sites are in each jurisdiction. And of course, the unincorporated Spokane County has 9 employers that are affected by the CTR law. Next slide. So just wanted to share results. I always love sharing this. So weekly, we remove 850,000 miles from being driven on our roads. So yearly, we remove over 44 million miles that are driven. We remove 785,000 tons of greenhouse gas emissions each week and over 40 million over the year. Next slide. So the CTR plans highlight the existing and future land use and transportation conditions and characteristics. And we worked with Jamie Hayes. She helped with the CTR plan as well. Highlights the benefits of CTR and how it will help the county achieve goals for the regional and state objectives. Provides baseline data for performance and targets, and we do that through our CTR surveys and our work sites. Outlines the services and strategies, especially what our office does to implement the law for the 7 jurisdictions. And then it also outlines the financial plan. And then we also did a summary within that, the CTR plans, and did some public outreach and then some engagement too. And we conducted that with all the 7 jurisdictions as well. So you can see from the baseline and targets, they base all of our work sites baselined in 2024. We have a 64.4% drive alone rate, and the target for the state is 60%. And so on there, you can see the drive alone rates for each jurisdiction, and then what the recommended reduction was for each jurisdiction, and then the target drive alone rate as well. So unincorporated Spokane County was a 71.3. With a reduction of 8%, bringing it to, sorry, I can't see that, but it's a 65, I think, 0.6% rate for unincorporated Spokane County. So next slide. Just to kind of give you the timeline, we started working on this in March of 2024, and we submitted it to SRTC in September for their review and approval. They did approve it. We sent all of the jurisdictions' CTR plans over to the state, and the TDM Technical Committee reviewed and approved those as well. And so now we're here with you all to get approval for the CTR plans, and those will go into effect on July 1st. Do you guys have any questions? Yes.
Two thoughts.
Yeah.
One, I was wondering if any of this information or data would be helpful for the new chapter of the comp plan around climate change. Have you been involved or sharing any data with the planning department?
So I think absolutely it would be. I just actually joined the climate, I think it's climate resiliency committee yesterday for the first time. So I haven't delved 100% into it, but absolutely, I do think that our numbers would definitely impact and be helpful for sure.
Right. And then I had heard that there was maybe going to be a cut at the state level for the CTR program. Did that end up happening? Do you know where that ended up?
Right, it ended up going all the way through and approved on both sides, and so now we're just waiting for the governor's signature. So it looks like it will be approved and at the 100% that it was previously.
Okay, so no cuts to the current level of funding.
Correct.
Okay.
Yeah. And the regional mobility grants too. So because we got a regional mobility
right.
grant, so that was also impacted with that one reducing it, but they were both brought up to the current level and passed through. So yeah, just waiting for the governor now.
Yes. Okay, thank you.
Any other questions?
All
That
right.
was a very speedy.
Yeah. One of you guys, I had a schedule, so. All right, well, thank you very much.
Thank you, appreciate it, yeah.
Good morning, commissioners.
Hey.
Matt,
Oh,
How are you doing this morning?
I am just so excited. of all of the different things to tackle. How about everyone else? Yes.
Just, I don't know, it is, I
Living
say
in
that
these
every
tight
year,
times,
but it
yeah.
just is like, it's every day, it's like this, so,
Yes.
yeah.
I envision the rest of the year will be like that too. So again, excited to take on the new challenges that we face.
That's right.
So this update's more of, or the briefing is more of an update for the board around a couple different projects. Kind of giving you guys an awareness, because I know the dates have changed a lot on some of these. So I wanted to give you an update on that, and also to brief you on our prosecutorial diversion program, which the contract is back up. So we just gave you an update, and then what's the CBAC contract to look for it in the following weeks to sign. So figured you get some information on that and how that is working with our department. Then I've got two things I don't have on the slides, just as an update or awareness to the board that I wanted to cover, get a sense on how we'd like to proceed. So that's the overview of the topics. Let's jump in. So our open set of projects. The ongoing work that we've been briefing the board regarding what we're doing with STARS. The purchase did go through with the building, so that's excellent. So now they own it and they're locked into a 10-year contract with Commerce as well as the county. And the implementation renovations are now going to begin. So in that building, for those that did tour and take a look, they'll be able to start making those internal modifications to make it both more therapeutic in the environment and really to begin looking at the 21st century. A lot of things in that building are relatively old. So,
Are they gonna start with the lower floor, building out more sobering beds, or are they, or do they have kind of a plan for the sequence with the upstairs as well?
so tentatively, they don't want to take off services offline.
Yeah.
So it might be a two-part one. The lower area actually has another side, right? So they have the sobering side and then they have a walled off side that actually had all the offices. They're thinking about starting there first, so we don't disrupt sobering services. And we did tentative updates to prepare for the sobering now, and they're gonna, once one side's completely redo that, maybe switch sobering over to the other side. So they're trying to play around what is functionally gonna work with some of the organizations that they're working with, for bids and whatnot. In the upstairs, they're also gonna do another half as well, so then they can flip to the other half. So they can wall off one side. They might do that simultaneously, depending on the availability of grants, or they might just do one portion. Okay. Either way, the goal is to not disrupt services. Yeah, if they touch the kitchen or anything like that, they'll have to come up with a contingency plan to ensure food and other services are still. We are just gonna schedule another visit when those renovations are occurring, so you'll get a look. So stay tuned for more of those. So that's hitting the ground running, and of course, our beds are full all the time there. So expansion, which we hope with this partnership with the city, can't come at a better time. So that has gone back and forth. The city had to review internally, determine how they wanted to put it before the council, and then there was a discussion on going through their entire review process or fast tracking it with the mayor. Discussion with the council on kind of an emergent need. They decided to go through that process. So last time we heard, the council will be seeing this on the 2nd, and then this will come before the board on the 3rd of June for signature for the opioid ILA project. So that is exciting. We finally have I say final tentative date. I hope nothing changes here, but that is the current plan. You guys will see that, and I will be working with Pat and Scott about releasing something on behalf of the board as well, ensuring that that coincides with what's happening. More to come on that as well.
So when I'm in the community talking about what we're doing in supporting more sobering beds, I get a little confused about the beds versus the chairs. So the capacity right now is 12. Is that what you're saying? We're gonna double that with this investment?
That's fine, correct.
Okay, so because some people might need a bed, some people could sit in a chair, so but technically it's 6 more beds.
It's technically 12 more slots.
Okay, so better to talk about like slots,
Yeah,
availability for 12 more people accessing
exactly.
the sobering
We usually let
services.
when they're in the sobering bed, so we're utilizing SUD dollars. If they're experiencing a mental health as a primary issue, then it becomes a challenge of how do we get them in. We wanted to skip past that. So that's where the chairs come in. Technically, they can sit and not be in bed, and it is that unique recognition of the law that has some vagueness in it that allows us to be able to do that.
Whatever works, okay,
So you'll have 24 is the goal.
that's great,
Slots available, but they'll all be at the 23-hour and 59-minute.
got it, all right.
Perfect definition of government.
Well, they didn't say we couldn't use a chair.
And so the reality is that,
I get it,
Better
somehow a bed
service.
has this other,
yes,
like other requirements around it,
exactly.
okay, got it.
And we didn't want to run afoul of UH.
Do we have a latest count of how many individuals have gone through? I know you were like at 400.
Yeah,
Ish.
I don't have the most latest count, but I know we've exceeded, it's continued at this
Same
same pace,
pace.
yeah.
About 80 a month minimum. And they've been actually pushing them through quicker, getting them up into withdrawal management. So they're not actually staying the full 23 hours. So that there has been some benefit to getting them actually into treatment. So that increases, again, availability of bed. So,
And the transportation, is that still being, the Stars is providing that car that picks folks up and drops them off there, but that's just in the city limits.
yes, it
Has
is.
there been further discussions about more transportation options?
Yes, we've met with the sheriff's department to talk about coordinating drop-offs. Because it can operate within city limits, there is an ability for the van to meet at city line and then actually do handoffs. So they can pick up. So we've kind of talked about workarounds there. Then we're also in discussions with the city on our partnership with fire as well. Is there a way that with the co-response project, which I'll give an update on that, moving forward, can we then also utilize CAR 50 in a greater region? So that's ongoing. So yes, there's also been a discussion of whether or not Stars can utilize other resources internally to transport that isn't just CAR 50. So yeah, we don't want transportation to be a barrier. And we want the ability from PHS, SRSC, and to Stars to also have immediate access. So working on that as well.
And my understanding is that's the drop off to Stars.
Correct.
If you're going from Stars to treatment, they have a separate transportation resource for that in-house.
Okay.
So if
Vast
you're going
majority-
from withdrawal management to inpatient longer term,
They will take you
they'll do that.
directly there. Okay.
Or to a medical appointment or to their mat treatment services, yeah. But they're primarily being served there in-house, which is why we invested in there. They literally just have to walk upstairs, which is where we get the successful treatment. So, yeah, no, a lot of exciting things there. Their Stars is very appreciative of the fact that now they own the building and they can actually focus on that and they're reinvesting those dollars. So I foresee a greater stability and this resource remaining. The state is still eyeing other facilities. In the Vancouver region, they have had a significant loss of one of their largest behavioral providers, including the provider of the ITA services. They're still not sure how they're going to fill that in. The state is still meeting regularly to talk to all of us about how can we help them. One of the biggest impacts of that was they were not getting timely payments from their insurance providers. And there was some challenges with the communities work with both the local county and with the ASO, which we don't have here. And so being able to bridge those gaps and not have to deal with lost resources at a critical time only highlights the work that we're doing as well.
Their ASO was contracted out. So it's in the contractor.
So it's, so putting these in place only further enhances and builds sustainability in our system. So they wanted to express that to the board, their gratitude and appreciation. Not only that, just how many voices that the people they're being able to serve. So I think they'll want to come and share that with you directly, but I wanted to give you that to you. The second part of this is the SRHD. We're still on pause on that. We're still having conversations with SRHD, and I believe there's ongoing conversations with SRHD and the health district board as well. So more to come on that one when we get more from them. But the goal for that is to, again, hold until we get some direction, both from SRHD and the health district board on a pathway moving forward. So more to come on that.
We're still having discussions ourselves. So,
Yes.
Yeah, I think it's on our agenda for running the numbers to see costs and potentially whether or not we can use some of the dollars of the health district to cover some of it. Some of the what's the right word?
We discussed it briefly at the executive committee meetings. You guys have discussed it
Yeah,
at
the
the
budget.
finance committee as well.
So, yeah, we're gonna get a presentation of some proposals and have a discussion on.
They're running a pretty healthy surplus at the methadone clinic and thinking that possibly being able to fund a lot of this with those dollars, freeing these dollars back up to help other folks in the community that may be of need, so.
And I think there's discussion on the hours. I think what the city was looking for extended hours versus what the county was looking at for extended hours versus what the health district is saying they would do for extended hours. And so that's one of the questions why you're here as we talk about it. And what do you think the extended hours need to be? I mean, because is just going to 6 o'clock or 6:30 at night enough, or is it further into the night?
So we've gone through this quite a bit, since they only do the OUD or MAP treatment, right? There is a component necessary for evaluation to determine, do they meet the need for services, right? You can't just say, here's an injection, go free, right? We don't know who you are, what you've been taking, or what medical complications you might have. So knowing that that all has to be encompassed with it, and the fact that at midnight or 3 a.m. may not be the best time when they're exhibiting certain symptoms, we've reviewed what the current trends are, as well as what the fire department on their current needs are in the community, as well as law enforcement. And it does seem like the 8 to 8 p.m. Timeframe, so 8 a.m. to 8 p.m. seems to be the ones where most engagement occurs with the community, and where there's a possibility for the assessment or intake to occur. So if it actually was to be expanded, I think those would be the only functional hours you would receive in the community. Anything beyond that would be stabilizing them and then getting them in the next morning. You know, if you see them after that time, you'll want to have withdrawal or some sort of medical stabilization. Then they can be fed back to the service. So that's what I would recommend. A 24-hour or car running around, they can't provide that same level. And they would be doing what we're already doing, sending them to a facility to sober or get medical clearance. And then immediately
Then
get
coming back for the full assessment.
And what's the current hours today?
that, I believe is.
5:30
5:30 to
morning
2 p.m.
till
30, something like that.
maybe, yeah, about.
Early afternoon.
But I don't know if they do assessments.
They
Well,
can do
but
assessments after that.
Yeah,
Part of the issue is it's appointment, and then if there's space, they can assess you as a new patient, right? But you're not guaranteed
But it's like
an
walk-in
opportunity,
only.
yeah, and they don't take a lot of walk-ins.
yeah,
That's the challenge.
I think if they have available staff, walk-ins from 8 till noon. If I remember correctly.
That sounds correct.
If that,
Because they're doing a lot of the treatment in the morning, in the early hours before work. So I think that, they're talking about going till 5 or 6, but really focusing on the walk-ins, like really, but also Saturday mornings, but maybe that is something to, maybe we should discuss whether they could go a little later during the week and then not do this. I don't know if, Seth, did you talk about from the fire department, like Saturdays or Sundays?
Yeah, they're seeing the same kind of volume on the weekends.
It's probably the
That-
same.
Yeah.
Nothing different.
For them, it's what they see, right? Is people are exhibiting certain symptoms. And from their perspective, there needs to be some stabilization. You have to stabilize and actually be voluntary to receive the treatment, which means you have to be assessed and then do an intake and give a history so that they can find if you're medically suitable. I think that's the challenge that's all encompassing. It's not just walk in, get a shot. So how does that actually work on the weekend? Is do you have the staff available for the 4-hour window for them to get medical cleared and then come in, do a full history? And that's the question of maybe viability for a program is more about saying on weekdays, we can get you in for walk-ins, but on weekends, it's about stabilizing you for your Monday appointment. And that way you don't lose them, but it's best use of resources because it's cheaper to actually have them in a unit where they're receiving treatment than keep them there and someone to come in and actually treat them at the facility they're at. So we're playing with different options there. I know we've discussed it. Question is, how do they get there and who's going to hold them and what service can they bill? And we're the only ones providing that gap and paying for the service where they can stay regardless of their insurance. No one else is doing that. Everyone else has to follow medical necessity. Hospital, gets stuck only because of EMTALA, but the reality being they can't always bill for it. So it's a loss for them. So what happens? Spokane County is the only one, and through STAR is the only sobering to cover that. So that's where we fit in and how we're kind of the stopgap for all of it. So piecing this puzzle together has become a challenge. So I do think there's a pathway moving forward, whether or not that's an investment with SRHD with additional dollars that are existing is an ongoing conversation.
And if the health district doesn't think they want to do it, then we would just do a RFP and find somebody else or
Well, so that's,
Pre-look.
so that's the benefit of what Spokane County has. We already have that treatment available there with them. And we have it 3 stars. So we're, for Spokane County, we're already providing. What we're not doing is partnering with other agencies to expand or enhance it so it's more hours. So right now, Spokane County residents who don't have insurance can go and receive that either through stars and their partnership with Multicare or through SRHD. It just is only at certain times. But we've provided the opportunity for them to stay at a place until they can get it. That's not available to other people. in the community.
Oh, go ahead.
Well, I was gonna just, I just spotted this, so your number here differs from the number that I think SRHD has been discussing. You have 350 from the city and the county for a total of 700. I thought the number that we've been discussing was 600 from the county of the opioid and 300 from the city. So
The numbers there are reflecting conversations with them regarding their cost estimate.
okay,
Their cost estimate has changed. If we expanded, if they said 1.2 million, but then not 1.2 million, 800,000, but that was based on numbers that did include administrative costs or other aspects. So we based it on roughly 700,000. When we talked with the city, they initially agreed to match, but then they said they came back at the 350 and only for the first year. So then the question is, will the county cover the rest, the delta of that, or will SRHD cover the delta of that? And then we do an amount in there. What I'm giving you there is, this is the current amount that we agreed with the city and the county if we were to have shared involvement with SRHD. If not, then the number would go up for us if the board chooses to.
Mhm.
And that was why the last time when I didn't know that, you had a worst case scenario where it was more money. I dialed that back based on this, and then now we're at a, it's changed so wildly that I just said, hold, we'll get you more numbers when we get a better idea.
And so the city is only, the 350 is only one time, basically.
The contract currently states that they will guarantee the first year with the option for the second and third year based upon their projects and initiatives. So yes, we can guarantee the first year. Another reason why I said I wanted to reevaluate, look at, is that even sustainable or viable for SRHD?
Yeah, and on that, it's, as you can imagine, it's challenging to step up a program with and hire and retain with only a 1-year commitment. So does it be more desirable to have a multi-year commitment on this? And SRHD is gonna be, I'm assuming, and you board members are gonna be in the position of determining the viability of only a 1 year.
The unique thing though, when you're running a clinic, is that if you're running it correctly and you're in the black, within a year, you should be able to bill for the services and pay for those employees. If you are able to
Yes.
run your clinic, in a sustainable way. So, I mean, so far, SRHD, there's been some little bumps as people came on and off.
Right.
Medicaid, after the pandemic, but in the last year, they've been in the black and they've seemed to negotiate good contracts with the MCOs, so
Yeah, and Milliman
hopefully we'll keep
changed.
moving in that direction.
Yeah, Milliman also came back with a higher rate for a lot of the services as well, which benefited them. And really what we wanted, we knew that this would be something that they would have to maintain. So bring them roles and they'd be able to receive that funding. So we always anticipated a transition period, a drawdown essentially from us funding them through these funds and them taking on through Medicaid. However, that, in my view, I like to always have a buffer year, a year of
Yes.
service and then a buffer year of transition. So it's a full year
True.
in case anything happens. That's where, when the city said they can only guarantee 1 year, is that something SRHD can, and is it the health board would like to move forward to then anticipate a delta there if that transition year doesn't go well to cover costs? That's what we're still projecting. So, we're still in conversation with SRHD. They're still our partner on our current services, so we anticipate giving them whatever information and or partnership they need to develop the plan. So we'll have more for you to be able to get more from.
I guess I would encourage you, if you haven't checked in lately with some of the data that you're talking about the hours. it might be good just to check in the next week or so, because I think our board meeting's on May 29th. So if you have better information about the hours, I know what they were proposing was longer.
Yeah.
And then like a Saturday morning, but I don't, if the Saturday morning isn't the best use of the staff and the building, going later in the evening might be a better use of those dollars. So I don't, there's always people that are gonna be, you need to come in and be assessed. And we wanna have that walk-in availability, but if it's better to, it might be simpler for the community to keep track of Monday through Friday, 8 to 6 or something like that. So,
And especially if we can work with other providers to bridge that gap on the weekend or other off times.
yeah,
And then, so it's not just one, it's a combination of providers in the community supporting that goal. So, one-stop shopping would be great, but it does overwhelm one agency to take on that. And there are others out in the community. Multicare is another partner that we work with quite closely, and they provide that service. So we're investigating all of those, but we will touch base with SRG.
yeah, maybe just provide some more information about the hours so they can run the numbers, maybe for both a Saturday and then a later during the week.
I mean, the whole point is to try to provide better service to the community, to get people into it, which we've got to look at what that is for the community.
Absolutely. Yeah. Really what drives a lot of that too is staffing availability. So, yeah, we'll get more on that. And then the last update on the projects we're doing with the city is the co-response. So that also, we finally worked out some final pieces. Expect it to go before the board on the 3rd with the city doing the 2nd. So we're gonna have the STARS opiate expansion as well as the mental sales tax co-response project with the city on Tuesday. 2nd, 3rd. So another hard work year. There are still pieces that we're working with the fire department. They're still working
This
through.
has been like 2 years.
It's been, how about this? My grandmother always says a labor of love. We'll just call it that. Either way, we're gonna get this done. And we had a final meeting with the city and fire yesterday to do a piece with our provider. We are on track. The plans are in place. We have an idea. However, we are gonna get started out relatively small, and which means we're gonna try to implement an initial team, work out some hours so we can finalize how that looks, because this will be the first implementation, and then we'll build up as we move forward. So we'll give more background to that when we have finalized it with the fire and they've discussed with their staff. But I do anticipate we'll be able to do a, wonderful joint kind of shaking of hands and kissing of babies down at one of the fire stations at some point in the future. But I'd like to get some things nailed down. And the provider will continue to be FPH. So they currently have the BRU, it'll be FPH with our team. So it's a seamless transition there. We shouldn't see any issues. And we already have the contract with the crisis side ready to go. So we've been ready to go for 2 years. To your point. So yes, I'm very excited about that. And hopefully we'll see that. No, we will see that on the 3rd. Next update is our PD program. So I'm gonna turn it over to Ashley as she oversees this program to give an update.
Justin, good morning. As Justin mentioned, this is just on our annual contract re-up with the DSHS for the prosecutorial diversion program, the PDP 5177, also referred to. We've held this contract since 2016. It's changed and evolved over the years, but this contract cycle, there's no changes programmatically or funding wise. Again, the funding contract total there, about 60% of that we receive monthly for admin, and then through participant enrollment is how we achieve the other part of that contract. And this contract is really to help reduce individuals referred for competency services, as well as to reduce recidivism and divert individuals with behavioral health disorders from the criminal legal system by connecting them with community supports. We provide intensive case management, care coordination, and peer support services, work with the prosecutors and municipal, superior, and district courts to help them be successful. Justin had previously also talked about one of our programs, jail transition dollars that we contract out into the community, braided with other funding sources. The sustainability of those other funding sources has not been there. And so we are pulling the jail transition dollars in-house, and we do plan to pair them with this diversion program to expand our scope and availability to ensure those services are still remaining to be seen in our community, and paired with pre-arrest and post-arrest and pre-incarceration and post-incarceration. And today I have Jamie Knox, our diversion behavioral health coordinator. He's been with the program for just over 6 years, to talk and give some information about the services that we're providing, what we're seeing with that. Jamie is the one who does that intensive case management, coordination, peer support, coordination with community stakeholders and partners. She's one woman show right now. Jamie, go ahead.
Thank you. So since the program started in 2016, we've had about 350 enrollees. It continues to tick up. I believe I'm enrolling somebody later today, actually. And of those enrollees, 72% of those participants receive a dismissal at the end of 6 to 12 months. Occasionally with cases going as long as 18 months, I believe, is where DSHS cuts us off. So that's a pretty decent success rate given a therapeutic court. And of those individuals, we only see about 15% of them back in custody within 12 months. So the recidivism rate continues to kind of maintain there. But we also see that folks who have accessed our program see other avenues to be able to resolve charges if they do acquire ones later, maybe an SOC, something with a little less handholding than say our program is, because they've already had that community engagement, connection, and resources with us. Overall, of our enrollees, we've seen less than maybe 2% of those people have their cases result in those 1077 competency evaluations, which is great because we know that that backlog continues to be there with the state. I did bring a success story. One of my favorite participants I got to work with, actually, a younger gal. She just turned 19 when she received her first assault charge as an adult. She dealt with the criminal justice system as a juvenile. She had a pretty difficult childhood. Her biological parents were very abusive. She had a lot of trouble building stability until her adoptive family came into her life at about 6 years old. However, she continued to deal with some other ongoing behavioral health symptoms as she aged. That's how she ended up in the juvenile system. Had what would have been a felony at 13 and went through a program a lot like this one. Had those records sealed and continued to do okay out in the community. She was formally diagnosed with bipolar disorder as well as ADHD at that time. But as she had just about turned 19, her bio parents tried to come back into her life. That created some chaos for her. So we had an assault event where she threw a trash can at a wall that resulted in assault charges. So I had the privilege of working closely with her. One of the biggest issues we found was creating consistent stability for her, getting her on the right meds. That was quite the journey, as well as getting her independent living, because she was living with her 8 other adopted siblings and her disabled adopted parents. So the household was very small for the amount of people in it. And why I liked her story and working with her so much is because her recovery journey was very non-linear. Some weeks we'd be doing just great. She'd be top notch. She'd be even looking at maybe getting a job. And then other weeks we'd be calling 988 together and facilitating some inpatient treatment to keep her safe. But overall, after a little bit of, she is one of those cases we extended out to 12 months, not just because we liked working together so much, but because we also work on that housing aspect in our program. So we had her living at the Phoenix House for half the duration of the program. And once we were able to get her dismissal order from the courts, we were actually able to sign her into an apartment that very same day, where she continues to reside, no issues, no interactions with law enforcement. She reports she hasn't even actually had to utilize the crisis line in several months, which is a big step for her. And she also, I recently got to talk to her, she is very and has a caregiver in her apartment where she lives. So she's a pretty good example of not everything works at the trajectory we want it to when we're dealing with these cases, but we're just kind of along for the ride and offering those supports and services wherever they may be needed.
So are you're the program?
Me and all my personalities, yes.
So how many cases do you have at any given time? How many people on your caseload? And then once that dismissal happens, are you done, or is there any kind of maintaining of the engagement?
And this is gonna be a terrible answer for that, but we don't really use cookie cutter solutions. So everybody's case looks a little bit different. Do we try to absolutely taper off the engagement at the end of that 6 months? Yes, because we're not billing the state anymore for it. However, we are still open for resource utilization, peer support, things like that for our past clients, just so that we can help them continue to be successful out in the community. Caseload, I think the highest I've seen it was we hit almost 50 during the pandemic. That was terrifying because a lot of people on the program didn't have cell phones, so it was very hard to find them. However, we also can dip down sometimes into the low 20s, which is fine too. We're just flexible, and quite frankly, I'm always trying to I almost use the word interrogate the public defenders to make sure that they're looking out for cases that might be appropriate for this program, because we're always willing to take more.
And what are the types of cases or types of eligibility requirements?
Across the board, we don't do DUI crimes, no crimes involving children, no sex crimes, no theft of a motor vehicle. I believe that's one set by the state as well. The most
Misdemeanors, low level felonies, though we've seen a lot more felonies come into the
yes.
What types of felonies would be common?
Malicious mischiefs, we've had several assault too. Sometimes the prosecutor likes to amend those down. But I think that's about our highest level one. We've also had a couple of unique arson in the first degree cases that actually ended up being very successful. So it really is kind of up to the prosecutor that's holding the case and what they feel comfortable with engaging in.
Jamie's worked really hard to build those relationships, so we have a really good connection with the prosecutors, and I think there's a lot more trust in trying those more challenging cases within the program because of that.
What's the overlap, if any, with our therapy? You mentioned therapeutic court earlier, so is there a connection here with our mental health therapeutic court, specifically district court? Or is this separate, distinct from it?
It's similar, and we do connections with relationship building, right? Who's appropriate for one versus the other. If they're being served by the court, then they're in that program. We don't simultaneously serve both. We can and would support them, especially with our jail transitions, which is why we're bringing in-house to further expand that ability to engage them. But a participant in how we get paid can't simultaneously also be required by the court to remain in certain court order treatment, which then makes it kind of disincentivizing for us to be able to continue with that. Also, duplication of services.
So outside, these are services, prosecutorial diversion outside of the mental health, our therapy courts. Is that fair?
For the most part, yes.
Okay.
Yeah. And
And all of those two options require the prosecutor to sign off on that, right? To go into mental health court or to go into this diversion crowd.
yes, yeah, they have sole discretion. Yeah. Since its inception of the program, I did some rough numbers on this and taking into account average stays and the fact that the program has diverted most of these individuals not out of jail and into the community. It's been a cost savings to the county of almost $1.3 million. So for a small amount, and for having one individual saving the county 1.3 for individuals that would have been in the jail is a benefit. And so we hope to continue that cost savings. And the state likes, we're the only one on the eastern side of Washington that runs this program. So.
One more question. So on the eligibility side, do they have to be diagnosed with a mental health issue to be eligible? Or how does that kind of, is there an assessment process at the beginning?
So when somebody enrolls in the program, we're gonna have them get a new mental health assessment anyway. Because not everybody who's experiencing those mental health symptoms is diagnosed. So when we start that referral process, we go off of what your symptoms look like. Have you ever been diagnosed with anything? Do you experience severe depression or anxiety or delusional thinking, things like that? So does it create issues if somebody is not formally diagnosed and maybe just playing us the whole time? Sure. Have we had that happen? Not since I've been here. Generally, folks know better when they have a mental health concern than we do. And a lot of folks are actually seeking treatment for the first time when they get onto our caseload.
So is this a kind of screening conversation that you're doing or it's happening? earlier somehow.
Depends on where they get caught.
Probation.
Jail screens as well as public defenders personally can send us referrals. So when they're dealing with one of those more unique cases and you can kind of tell in the police report that there's definitely a question of competency or
Okay.
mental health concerns, then that's when they send them over to here and we kind of
Good, thank you.
So board will see that coming forward here for signature for the July 1 period. We'll give you an update on all of our other contracts, so that's gonna be the Justin-a-thon that will come in June, but for now, that one will be, we need to move forward with this one quicker than the other state contracts. So I have 2 additional updates. This is off script, but there are ones that came forward when I submitted this, so I just wanted to make the board aware of it. The ILA with the Valley, we were able to meet with our legal team and their legal team, and we said no to the sections that we'll be submitting an updated one. They want to move forward. They just want some assurances that they'll be part of the process. So we gave them that. But at the same time, we said from the beginning, our expectation is administratively, the amount you're giving us would have to be used to cover the cost to give you the reports that you're asking for. So they agreed. So we'll see that moving forward. We don't have a timeline. It's not imperative right now, but we wanted to get through these other things. You'll see that. So it went well. We were moving forward with it. Then the city approached me for another potential partnership. They are wanting to invest some money into Manny's Place. And they think that what we're doing there is awesome and what Manny's Place is doing is awesome. And after the ledge session and the ledge dialing back some funds, they would like to put some opioid dollars forward. They would like to do an ILA with us and pass the dollars through us to give to Manny's Place to support our project. It'd be a one-time, but since we already have 3 out there, we've been working with them on, they wanted to throw on a 4th and talk about how they could support our project with Manny's Place.
So why go through us versus just do it directly?
I can speculate. I don't know if you want to share how you want me to. I believe that going through our existing contract would be easier, not only administratively, but functionally for them. And it also would allow us to be able to direct it under our current contract, under the scope of work for the services. They wouldn't have to create it from scratch. Essentially, it's easier to go through this.
The RFP process. Because we've already
We've
Done
already
that.
done that. So, is there additional cost to us to do that? I mean, I know there's some administrative costs.
There would be just be the administrative cost for our team as well as theirs. And we do expend our time towards the opioid account for admin costs, but we consistently have been drawing down less than what we've projected. We've been more efficient that way, keeping it in-house with ASO, since we only ascribe our time and the rest is covered. No full-time staff are actually assigned to it. Although I think one of my staff would have said that they probably are. The reality being that we were able to save costs that way. Keeping it in-house with ASO is maintained that.
But would we charge some administrative cost to that grant as it passes through, correct?
We're in discussion on whether or not it would be the city's or it would be ours administratively. That's still to be discussed. I would assume it'd be towards theirs, yes. We would charge it towards their money they're giving us. It'd be less our administrative costs and the remainder would be passed through.
I guess that's what I'm just kind of like 10% would be to admin costs or whatever you think is reasonable. But I mean, we need to be looking at, I mean, I think we've been so good about trying to take care of everybody for so long that we have to start charging, for some of these pastors. There's some that we don't. I mean, that are just, if it's just a dollar amount going through and then going out somewhere else. But I think, your team is still doing a lot to then manage the contract.
And we do, based on the One Washington MOU, we do have the ability and we are charging and collecting program administration fees from the dollars, and the OAC, which is under Justin's team, also has the ability to receive up to 10% for all their reporting and annual stuff that they do as well. So we have that built in and are getting reimbursed for that.
Okay.
We're still working with budget on how we assess that with the municipalities. But yes, it's all been agreed to.
I was gonna say, it sounds like a vote of confidence in the priorities and the work that you're doing, so that's good news.
And it helps Maddie's Place. I mean, we all know that the end result is that there's gonna be babies serving our community. So I bring this forward because we're willing, I support this in terms of our ability for our team to be able to maintain it, and within our contract, it fits the scope. What I'm asking is, would the board like us to begin the process of reviewing ILA to move forward with that? Pending, of course, legal sign off and review based on our ability to enter into an agreement with the city. Excellent, excellent.
Yes. Heads are nodding.
Perfect. And then the last one, we have been tracking all of the national movement on Medicaid. So I wanted to give an update because I've had questions on this. What is the impact to our community? Based on what we know, I just want to quickly share that what we heard from the current big beautiful tax bill that's before Congress is that there would be no immediate cuts to the overall amounts given to the states. However, there are various caveats that would be put in place that would look to trim costs. One of those would be individuals at a certain threshold would pay a proportionate share of their care, kind of like a co-insurance. So if you're on Medicaid, you would pay a portion of that. Another one is for greater eligibility checks, so more frequent eligibility checks. Individuals may be kicked off rolls. And then they would cap the amount of provider taxes that the states assess. That's the amount that the states tax the insurance companies, who they can then roll that into the amount that they submit to the federal government for reimbursement for Medicaid, which means that they can't increase that, so they can't account for additional costs that hospitals or insurance companies may experience as part of this. If that's the case, that would limit growth or potential cost of living, but it does indicate that at least existing funding would remain. So it's not doom and gloom on that end. However, any changes to individuals' eligibility would flip into the non-Medicaid side. There's been no increase on the non-Medicaid dollars, which means currently King County and Washington and Spokane County Regional Service Area are the only ones that do voluntary services for inpatient and outpatient services. We pay for non-Medicaid people to receive treatment outside of a forced treatment, which is what the state mandates. We have a limited amount of money. If those roles increase because non-Medicaid would be more citizens would need access to non-Medicaid that we don't have a lot of money for. So the existing sobering services, we've seen an influx. A lot of those are Medicaid. If individuals aren't receiving services upstream, we may see more. So I just wanted to make the board aware. We are tracking. We should have more information available. We'll provide them at the next briefing. But
So to clarify, I think the latest estimate I saw from the Congressional Budget Office was like 8 million or so nationally could lose their coverage due to the eligibility changes and the things that you talked about. So that's a fairly large slice of people. If you break that down to Spokane County, whatever that rate is, if that population is trying to go to the sobering beds, but they don't have Medicaid, you're saying we have a limited pot at the county that helps pay for that, but that put pressure on that pot.
correct.
And what are the sources of funding for that pot? One is mental health sales tax, correct?
It is for Spokane County residents. We also use GSF state dollars for the inpatients. And then we use block grant dollars to cover remaining others, and then acute care diversion. So there's various pots of money, but state and local dollars. If those increase, of course, it would be dependent on their eligibility. But it would essentially mean once we hit our cap, and there is going to be cuts to the block grant dollars. So that means already we're looking at reductions, we're filling with GSF, which means we have no expansion. It would mean then, once we hit that, whatever time of the year, we just revert to involuntary treatment, and that's it. Again, outside of acute care diversion funds at the SRSC, that's kind of separate, and we usually manage that differently than the other ones. And then also sobering, it's paid out differently as well. So those services may continue to limited capacity, but you'd see like outpatient services, expanded behavioral facilities, and inpatient voluntary. Most individuals, when they're sent to a hospital involuntarily, are paid for by us. All Spokane County and Spokane Regional Service Area people, regardless of their insurance, excluding Medicaid, are paid for by us if they're involuntary. Any one of you got detained, we would be paid for you. Not that it would happen, but if it did, we would, and I would keep that confidential. And then,
Why are you looking at Scott?
the general, it was the general, I started there and I moved it around.
You'll be in here the very next Tuesday to explain yourself.
Exactly. But then, those would be our primary, they switched to voluntary generally after a certain amount of days. That would mean they would be paying out of pocket. We would be able to cover, which means you may see increased medical costs per individual overall. That would be the end result, but it wouldn't be immediate. We would be able to function within that year, but then as we see the changes occur, of course, we'd review on that. Again, we're better positioned. We've been doing this for a while. We've also been scraping the barrel for funds. I am not concerned about our immediate ability to cover existing individuals in the community. However, I just wanted to make you guys aware that in case in the future those changes did occur, we may have to make some decisions on where would the prioritization be of services. So that's a 2026 conversation, I think.
So to clarify, in the short term, we've got some dollars to cover any gaps that result from people losing coverage, but in the medium and long term, we may run out of money to do that.
Yes, and you guys know me, I like to plan in advance, so we don't have to wait till the last minute for those to occur. So I like to project, and my hope is that we'll give a projection sometime after September 30th, when the federal budget, whatever happens, comes through, and we get more clarity, and then we'll begin projecting for the January 1st. Where even if the changes would be felt immediately, we can be implementing contract changes for the next year. So more to come. Right now, we just heard that bill. I want to make any, then I'll get questions that just got made public.
Thank you.
Wonderful day.
Yes, you too. Thanks for all the information. Thanks for all you guys do. Hey, we were ahead and now we're behind.
He caught us back up.
Charging Chris, welcome.
Good morning.
Good morning.
So last week, Chris and the team were here to provide an update on the different subrecipient agreements that we're bringing before you. And then today, what we'd like to do is let you know approximately what we're planning to get from Commerce. We haven't had an actual budget signed by the governor and everything yet, but we've got numbers, so we want to bring that to you all. So Chris will go over that.
Yeah, excuse me. So in front of you, you're seeing the allocated award from Commerce to Spokane County. It's coming through a couple of different funding sources. CHG standard is broken up there in that 2.1 figure. You guys remember homelessness prevention being a separate category that's remaining the same in this biennium. That's the big number there. You can't see from back here, but it's much bigger, much larger. Then you've got two inflationary, thank you so much, that 8.4 number. Two inflationary costs or awards at 1.6 or 1.8. That's about, let's see here, about 926,000 per year. And then we've got the document recording fee backfill, which is that $1.8 million. That all adds up to about $14 million, what we have to work with from CHG. A couple different plans for the eviction prevention dollars. I believe everyone was briefed a little bit about the split with the city of Spokane. So we're working with them on their eviction prevention projects. We've got about $9.8 million allocated as part of the last week's briefings for the projects that we brought before you. So we've got a little bit of work to play with to get up to that about $10 million if you subtract that $3 million coming from that $14 million. So we know the projects that are recommended, we know about the amount that those cost. Now we've got to fit them into the appropriate budget categories. We'll submit this CHG application part 2 to Commerce this week by Wednesday. And then from then on, we will present or put the CHG award in front of the BOCC for legislative approval when we get it, which to be determined. Allowable county admin is that 1.6 number there. It may not be the full extent of that depending on the allocations, but that's about 15% from each of those categories. And I believe that's it. Any questions for me?
So last week, when we were looking at the other funding sources, you were saying that you thought there'd be more prevention funds coming. Is this what you're referring to?
Exactly.
Okay, so you were just kind of waiting on the final number from the state.
Yes, ma'am. At that point, we knew that it was gonna be higher than we anticipated because they're fully giving it in Spokane County, but we didn't know it was 8.5 or so. These are the actual numbers. This will be in the contract that is presented for you for legislative session in a couple weeks.
So is there additional dollars that we haven't allocated yet then from the 8.4?
It'll be close. There will be a couple dollars here and there that are not exactly up to that 8.4. So part of the CHG application is to put in those project applications, their full budgets, and kind of plan out our budget. Once we get to that point, I'll know, roughly we've got 100K left over. We can reallocate those funds for next fiscal year. We can allocate them to the projects that we've already had recommended, give some of those underallocated projects potentially more funding. That's just something we're going to work on next week or so.
So I think when you presented last week, you showed kind of where we hadn't fully funded some of them and so.
Exactly, yeah. Yes, ma'am.
Good, I know that pot of money is critical. Cause I don't think any of the HUD money can be used for rent or basically stabilizing somebody before they're homeless, or very little of the.
I get about $135,000 a year from HUD. We've got additional HUD funds as well, but just for those kind of supportive services. So we are using that for rapid rehousing, just because it's a small amount of money. Any other questions?
Can you just, so I'm following the numbers, can you repeat one more time? What is the difference between what you presented last week and what this number is dollar wise,
Oh, gosh,
roughly?
I think I would have to send that to you. I think I probably would have said about 2 million, about 8.5 million.
Okay.
Did I print that off? I didn't print out the last briefing packet, so I'll print that off and give you the delta between those.
Okay.
It's going to be higher.
This number.
Slightly, yes, sir.
Okay, all right, thank you.
Yep, sorry.
Yeah, and really Commerce told us early on to budget for a 20% reduction. And we did not get a 20% reduction. I think we actually got an increase. So that adds to some of that balancing out that Chris is talking about.
I'll send it over
Great.
today.
Thank you guys very much. Appreciate it. It's gonna take us to. Yeah, you're gonna sit at the head of the table and then Rebecca will move the slides for you.
Perfect.
Welcome.
Thank you for having me.
Yeah, appreciate you coming.
It's a long table.
It is.
Chair Kinney, County Commissioners, thank you for the opportunity to talk to you about Launch Northwest and your investment in Launch Northwest and the work that we've been doing. It has been a fun ride for us, and I'm going to go through slides and talk about results. This is about where are we seeing the results of the investment. And what you'll see are mostly leading indicators today. Lagging indicators would be graduating from college, lagging indicator would be enrollment into 2- and 4-year universities. Lagging indicator would be into apprenticeship programs. And again, this is our second year in, so we've seen just 1 year through, and those lagging indicators will come probably in August of that. But we have leading indicators, and we know that leading indicators, if we can see movement in these numbers, will show that we have positive results coming ahead of us. And so I want to really talk about those. First of all, our mission is to galvanize entire communities to ensure that every child finds belonging and travels their best journey from birth to career achievement. And it's really important that people understand we are not about just 2-year or 4-year degrees. We're about credential programs, apprenticeship programs, work-based learning programs. And I've got some exciting news about how we've invested in some of our work-based learning programs coming up. Ultimately, we're connected to the Innovia Foundation. through their strategic vision and their framework. And that vision is for them is ignite generosity to ensure to build vibrant, sustainable communities and economies. And our vision coming from them is a robust economy with vibrant and sustainable communities wherein every individual thrives. We're really then about our mission, though, goes to the individual. And we're working with not individuals in the systems that impact them. But this really is about economic development when it comes down to it. And so I want to show you a slide that I think shows the challenge that we face in the state of Washington, and in particular in Spokane. If you just take out a projection of 9 years, and this is done by the Partnership for Learning and Washington Roundtable, which are both business-led organizations. There are several people from Eastern Washington are on those boards. They did a study of what was going to happen to the workforce in the state of Washington over a 10-year period of time. And so, you know, you look out, and this is projected out to, I think, 2032, and you might say, well, that's not that well. That's pretty close, and it starts to get really scary. And the scary thing is that these projections show that we will be short 301,000 BA or 4-year degree or above workers in the state of Washington by 2032. And 228,000 credentialed or skilled workers. And what I mean by credentials, whether that's journeyman techs, those skilled workers that don't need a 2-year degree. And then about 67,000 workers who have a 2-year degree. I had a chance to visit a local doctor the other day, and there are a lot of 2-year degree programs that support our healthcare system. The sonograph, the x-ray techs, many of those technical jobs that do require a 2-year degree, and we're going to be short in those areas. The scary thing is, if we do nothing about this problem today, we will have a surplus of unskilled labor, which means that we will have about 254,000 people looking for jobs in a market that they're not qualified for any of those jobs. And so with that backdrop, we do our work at Launch Northwest because we are about building futures in that individual. So again, really focused on the individual and how do we help individuals and families, but we have to keep an eye on this big piece of what is happening in our economy and what does this mean for us as we move forward. We know that our kids face challenges. So we've got this workforce challenge, but we've also got this challenge amongst our kids growing up. We know that we have mental health challenges amongst our youth, 10 to 17-year-old. We have attendance problems in schools. I think 32% of our students miss more than a month of school in Spokane County, right? We know that our kids graduate high school at 92% rate, but only 47% of them go on to a 2 or 4-year degree. So we see some challenges facing us as we look at this. And so how is it that we, as Launch Northwest, our organization, how do we start to meet some of those challenges? We also know that children enter kindergarten ready to learn at about 42 to 43% in Spokane County. And that all of those points along a child's pathway makes a difference here. So what we have done is created programs and implemented those programs with partnerships across this entire county. This is not Launch Northwest doing this all on our own. This is Launch Northwest partnering with schools. It's partnering with communities and schools, Big Brothers, Big Sisters. It's partnering with all of our other nonprofits to say, how do we come together to change this? We're partnering with our cultural centers. We're partnering with early childhood engagement specialists that are not our employees, but we're contracted with them in order to do this work. So I want to just talk about each of those initiatives, and you'll see those on this slide. One of our big initiatives is Engage in Real Life. This is a partnership with Spokane Public Schools. I'll get into that in just a second. Empower Mentoring Program is our mentoring program that is right now we're in 13 Spokane County high schools. And I'll get into that. All it takes is one. We believe that if we as a community are going to meet the challenges that are before us, that it's gonna take volunteers and it's going to take all of us getting engaged. And all it takes is one is that. We have a youth leadership council. And then the Launch Northwest Promise Scholarship, which is kind of the topper. We'll get into where we're at with that. And then the FAFSA opens doors. We know that one of the first steps of post-high school education, whether that's apprenticeship program to a 4-year degree, is completion of FAFSA. And we're 47th out of 50 in the United States for FAFSA completion. Yet we have one of the most generous college grants in the whole United States. So why is that? We left $69 million in financial assistance on the table last year. And so you think about that. The economy in Spokane County is driven a lot by our higher eds. WSU, the Gonzaga, Whitworth, community colleges, Eastern, I'll have a big presence here. And we're leaving all of that resource for kids to attend those universities on the table. So I want to talk about this next initiative, which is Engage in Real Life. So Engage in Real Life is a partnership with Spokane Public Schools. And what we have done is we have hired engagement navigators in Spokane Public Schools. We've hired engagement navigators with our cultural centers, and we've hired early childhood engagement specialists. We know that the youngest of families cannot feel isolated, and their children need to be, and they need to be part of the community. And so the whole effort is, how do we get every child engaged in our community every single day outside of the school day? One of the things we also know that social isolation has gone up tremendously amongst our youth. And we also know that that attendance piece that I've talked about, kids who are engaged don't attend school. If they're not attending school by the time they graduate, are they going to attend when they get a job? And we've got to really start doing that. Well, what do we know about after-school programs and Engage in Real Life? We know that students who are engaged in after-school programs, who are engaged in community, have better attendance, they have better grades, and they have better mental health. We also know that the students who are of lowest income oftentimes are not engaged in these activities. And we're looking at ways to really take advantage of that and change it around. Let's go to the next slide. So here's what, go ahead.
I was just gonna ask with, are some particular schools really pushing that and making sure that as many students as possible fill out that plan?
Yeah, the Engage in Real Life
I
plan.
mean, is that why you see some schools with a really high percentage? Because they've made that a priority?
Yep.
Okay.
And right now, the data will show that in the North Central attendance area, when you look at the number of after-school activities that are going on and students participating, we've got a little bit of a hole at Yasahara and Gary, or Glover, excuse me. And we've got to really concentrate there all across the entire system. And you, again, when we pull the data and we can see it, and that's the nice thing about the leading indicators of data. This comes from Spokane Public Schools and their data system, which is nice. We can see right there, and we can see less activity by that engagement navigator in those areas, and we have to work on it.
Because quite frankly, like from my experience, there's not a lot of after-school opportunities.
Right.
So those have to be somehow generated with community partners. And I know Gonzaga plays a big role in doing a lot of that in that area.
Yeah. We also at Launch Northwest actually provided grants to our elementary schools and Spokane Public Schools for after-school programming. So there were grants available from $1,000 to $2,000. If they partnered with a community partner, they could get $2,000. And we really wanted them to be partnering with people. So the dual language academy, they partnered with Nueces Raices. So they got $2,000 and they're doing ballet for Glorico, and Nueces Raices is providing those pieces.
Did you say there was 15 schools that you guys are in? Is that the number you used earlier?
13 in Empower.
13, okay, so how are those spread out amongst all the districts in there, and how do you determine which schools you go into?
Yeah, so we've got 13 schools in Empower, and all of those schools, the only schools that are not in it, we have 2 Spokane Public Schools in there, and the rest are our Spokane County high schools. And we're really looking at a demographic that that fits. We're looking at free and reduced lunch, mostly in those areas. So you look at U-High, CV, we're not in Ridgeline, we're not in LC yet, we're not in Ferris, but we partner with the Aspire program, which is in Ferris, and we're not in Rogers because of the amount of services that Rogers already has. So we're in NC and Shadle in Spokane Public Schools. We're not in Freeman or Meade right now. We're in Mount Spokane. We're in Cheney. Yeah, all the rest of them. Medical Lake. I could rattle them off. But
Is the plan to be in like?
we want to be
Freeman,
in every
Meade,
single
all
one.
of- Okay.
Engage in Real Life is focused on Spokane Public Schools. This is paid for largely. The county money goes across every program that we have. Spokane Public Schools, this is largely paid for out of the city money that was granted to us. Just so you know, I don't have the complete breakdown, but could get that. But as you look at that, our first year of this, we've got 63% of the entire student body is engaged in real life activities, and we have 18,242 students engaged in real life activities. You can go to engageinreallife.com. You can log on to our website. If you're a family and you have a young child and you want them engaged in drama, you can click in drama as the activity. Up will come all of the organizations that provide drama for students after school. You can register right from the website. We're also building a registration system for our smaller nonprofits so that they can use our registration system for free, so that they're not out buying one-offs or creating things for themselves. But that then gives us the opportunity to have a really robust understanding of what is happening across our entire city and county eventually. You can see that I have updated data on Engage in Real Life that will come to us. We're actually going to hold another press conference on June 10th, where we are going to reach out to the community and say, in August, we came out and said we were going to do this. We want to come out and say, we've done it, and here's the results that we're getting, because we think it'd be just disingenuous to say, here we are, and then not follow up with the results. So that's an accountability piece that we have in. Let's move to All It Takes Is One. All It Takes Is One is our volunteer program. So we created All It Takes Is One as an umbrella media campaign to engage people to re-establish engagement in community after the pandemic. It just went poof. Mentoring programs are suffering. The Reading Buddy program in Spokane Public Schools, volunteers in all of our schools across the county were just down. So we started the media campaign and we got some really good traction. We got great impressions from that. I think we started to introduce volunteering again to the community. Well, then what we did is we decided to partner with Spokane County United Way of Spokane County. And we have partnered with the Volunteer Spokane website. Why would we want to do another one? And we said, let's do this together. And you can see the increase. I think we increased the number of volunteers year over year by 40% through that Volunteer Spokane website. You can go on to Volunteer Spokane right now and you can say, you know what, I want to volunteer just in a community. I want to do Meals on Wheels, or maybe I want to do a cleanup project at a park, or maybe I want to be a mentor. And the categories are all color-coded, so you automatically know where to go. And then you can go to youth serving organizations. So if you want to volunteer in Reading Buddies, you can get on there and volunteer. So the website has just been tremendously improved. We've got a great partnership with United Way. The next part is that we're going to take this out and do grassroots work, block parties with people, asking them to sign up, getting them engaged. So we've taken it from media. Now we've got the connecting site. Now we're going to go, we got to get on the ground and we've got to be in front of people and say, this is how you can get engaged in the community. Josh, this is where Commissioner Kearns, this is the next one, Empower. This is the mentoring that is in 13 Spokane County high schools. And some of this, Tricia Kearns, comes from the fact that we don't want to be where we're not wanted. We want to be invited in. And so some of this comes from schools who are ready, who see the need and they're ready for us to be there. But like I said, our students receive support through peer-to-peer mentoring, near-peer mentoring from Gonzaga, Whitworth, and Eastern Washington University. They also have adult mentoring programs. We actually train adult mentors, and then we put them into the schools. It's a site-based mentoring program, so it's not the same as a Big Brothers Big Sisters offsite program, but we're probably going to work to do an offsite wraparound mentoring program as we get going. They receive support in applying for college apprenticeship programs, local scholarships, our financial aid, et cetera, as we move forward. We also partner with Family Promise. We have Family Promise in 6 of our high schools. Family Promise is in Shadle Park, North Central. They're in East Valley, West Valley, and also in University High School and Central Valley High School. And they provide services across the family feeder pattern. So if a student is in high school and they have siblings, they're covering that entire family. But maybe somebody in the middle school knows something. That case manager is also working with those families of middle school students to keep them housed so they don't become unhoused. We know that intervention is absolutely huge. So leading indicators from our Empower Mentoring program. In our first year, we served 1,700 students. 2/3 of the students said that they intended to pursue college. We outperformed the state by 5% on FAFSA completion, and 62% of Aspire mentees plan to go to college. This year, we are serving 3,500 students in 13 high schools. 134 peer mentors have been recruited to serve students. And again, we're on pace to outperform the state in FAFSA completion. One of our big success stories is Riverside High School. And in Riverside High School, we have a big FAFSA opens doors and Empower is there. Ken Russell in Riverside has been a champion of making sure kids in Riverside have opportunities beyond high school. They increased FAFSA completion from 28% of low-income students to 62% in 1 year. Their graduation rate amongst low-income students improved by 5% in 1 year. And then 56% of the current seniors in Riverside have filled out the FAFSA. That's a huge jump across outperforming every student, every high school in this region right now. And if you know the economics of Riverside, they are not a high economic school, high income school, and they are doing just tremendous. We have a FAFSA challenge that we're sponsoring right now, where we're the people who can increase the amount of we set individual goals for them. If they complete them, then we give them grants to their schools, and so we're seeing that increase across all. I think our FAFSA pieces are just absolutely critical. The next slide. Our Launch Northwest Promise Scholarship. Yes.
Can I just follow up on that? Is one of the biggest challenges with FAFSA folks just feeling like they're not sure if their student will do something post-secondary right away, so they're not sure if they need to fill it out. There's just or they're not necessarily thinking the student might do something, so there's no need to fill it out. Is it kind of just that? Is that one of the biggest challenges?
Yeah, I think the unsureness of what what a student is going to do, so they don't. I think the other thing is distrust of the system would be another reason.
Because you're sharing your income information.
Yeah, and the thing that's really nice about the new FAFSA is you're not sharing anything that the government already doesn't have now. I mean, you're not bringing in a bunch of paperwork and all these other things. If your tax return has been completed, you're basically just clicking a button and boom, and it goes across there. I think one of the things that we're coming up against, Commissioner Waldorf, is the the fact that we are coming up against parents who are actually saying, I don't know if I want my child to do better than I do. We're hearing stories from Catholic charities. Every senior in the Catholic charity system fills out the FAFSA number. Their case manager helps them fill out the FAFSA. And we've heard stories from Rob McCann that these kids get lots of aid, and then the parent goes, I don't know if I want my kid to go to college. And it is an interesting dynamic that we're facing. More and more, we're seeing this, that families are not sure and don't trust what's going to happen next with their kids. So just an interesting dynamic.
Can I ask, are you seeing any, so I've seen a lot of reporting over the last 2-3 years that there's an increasing gender gap in folks that are going to college. You're seeing males go to college at a much lower rate than they used to, and you're seeing a spike in females attending college. Are you seeing that same demographic when it comes to folks filling out the FAFSA, when it comes to folks that are utilizing your programs? Are you seeing females more engaged than males? I mean, is that national trend present here in what you're saying?
I think the national trend is absolutely present in the ongoing rate. As far as those that are in the Empower Mentoring program, we're not seeing a difference in participation in our programming between males and females. But actually going on, yes, we are. It is a huge issue on our campuses today.
Okay.
And not huge because there's more women on campus, but huge because we need more degrees and more credentials across all of that. And we could say that we need more women in some of the technical career fields as well as we go forward. So, Mr. Kearns, I absolutely believe that we do have an issue that we have to get our hands around.
Okay. Like, I mean, when I was entering, college, I mean, there was a big push at the time of we need more females in STEM programming. That there was that big push. We saw that push. I mean, it went on for, 10, 15 years, on there. I mean, and now we're seeing kind of the where you're looking at overall college degrees. I mean, I think, women are very well represented. I think across the board, kind of when it comes to all the degrees, but you're seeing sort of the males kind of just regardless of degrees, the overall I was trying to do some quick Google searching. I think they're saying it's at about 60-40 or at least fast approaching 60% of folks on your average college campus are female, 40 are male. I mean, are you guys trying to target male demographics to try to
we have focal population.
Yeah,
we're targeting all of our focal populations. The mix of our scholarship doesn't seem to be off right now, but here's the other piece of that I think is absolutely huge. Males 18 to 24 who are not going to college are not participating in the workforce either.
Yeah,
they're playing video games. Dead serious. The research is showing that 25% of males who are not in the workforce are doing nothing but playing video games. My son is home from college, and guess what he's doing all the time? He's playing video games. A grade in one of his classes looks like he was doing that at college too, but
He's not playing Mario Kart.
yeah, I don't know. It's not that anything is a little more.
Mario Tennis.
We are absolutely looking at that issue, and you can take a look go on to our website and on the Measuring Our Mission, and you look at the going on rates in Spokane County. You can click on the going on rates in Spokane County and hit male, female, Josh or Commissioner Kearns, and you'll get that. You'll get that breakdown. And it definitely is there.
Do you have any numbers then on students that are pursuing like not 2 or 4 year degree programs, but like entering the trades, entering apprenticeship programs that maybe, I don't know if those all require that you have a FAFSA filled out, right? If you're just gonna go start working with a company and get trained into their apprenticeship program.
We do not yet have reliable sources for that, but we're looking at trying to build that out. So for example, we just signed an MOU with Chaz Health, where we will actually offer our scholarship to Chaz Health apprenticeship students. So those that go into the medical assisting, the dental assisting, and also the farm tech. So we'll pay $1,000 towards this program, $1,000 towards their tutoring and programs for them to pass the test. And then we'll do $500 towards their uniforms and their supplies throughout the year. So we're there. We also have an MOU with AGC. So we're going to start collecting some of this data. But there is no reliable source at this point in time that we can point to do it. So I know I'm going over my time. So as we look at the scholarship, and I'll end with this piece, we had the scholarship is really important. And to be very clear, none of the county money goes towards our scholarship fund. Our scholarship is privately raised. We've raised at about $83 million right now. That's cash flow gifts and then legacy gifts. So we have people who will give amount of money, like $1 million over a 5-year period of time. And then they say, well, when I mature, then and my estate is moved to Innovia, then here's the rest of my estate will go to the scholarship. So when you look at those two buckets, we have $83 million. Right now, we had 113 students awarded. Our total commitment this year for the first year of this was $476.54. That's a commitment of nearly $2 million over the 4 years of somebody's education. Our average award was $4,200. It's really important to note that our scholarship application is not hard and it's not competitive. It takes 16 minutes to apply. You don't have to write essays. You don't have to have a required GPA. This is to jumpstart kids and get them going into their future. And so we want to make it very, very simple. The median family income was $68,000. And again, one of the things that's really interesting, we don't have a STEM focus or a degree focus area with Launch Northwest. But if you look at it, computer science, education, engineering, nursing, these are all job fields that are absolutely needed today. And our kids are selecting to get into those as we move forward. This next year, we expect to award 250 scholarships to students as we move forward. I'll stop there and see if you have any questions.
No, it's quite the initiative that you guys have taken on in a couple of years' time to make these changes, because it really is, being on the CF Leads group with you.
Yeah.
We still have one more meeting, the economic mobility that this really does provide. I mean, it really is looking at how do we help our kids? How do we help our economy? Because all those things work together to drive it. So it's pretty exciting. And seeing what's happening, especially just up at Riverside. I mean, that's huge for those families in that area.
I know when the concept of Launch Northwest first came to be, I think it was based off of Buffalo and some other cities. I know Shelley O'Quinn, when she came in and presented to us, the concept was that sort of the scholarship portion of the program would cover the gap. If any student in the county, any high school, you graduate, you would go, you'd find what scholarships you could get, what state aid you get, and then whatever that gap was between tuition and what you had secured, that Launch Northwest would fill that regardless of income qualifications or anything. Is that still the long-term goal to get to that place down the road?
It's a long-term goal. When we really dug into the numbers, Commissioner Kern.
Yeah. I assume they're astronomical.
They're astronomical.
Yeah.
And I think what we're trying to do is look at the data and what does the data tell us about the needs and where those needs are. And so I could just, for example, where some of the needs are coming out for us, You know where our highest income families are going to school? Community college. Why? Because they don't get aid at the, or, you know, they don't qualify for aid. And so the most affordable place for them is that community college. So if we can work at looking at a community college promise type program, that we can say, here's a 2-year step for you to 4-year, we can really start to move that. And community college, I think, is $5,800 a year for tuition. And if we can get kids to understand and know that, while at the same time, some students will do better at our smaller 4-year universities. We'll do better at a WSU. And so we don't want to limit where kids want to go, but what we do want to do is make sure they've got the right fit. So we've had to adjust back from that, Commissioner Kearns, so that we could make sure that, one, my job is to make sure that we're financially solvent and that we can meet the needs. We want to expand that to more and more kids, but we think we will always have an income cap.
Okay.
Right now, our income cap is 150% of median family income. So a family of 4 is about $160,000. So we are hitting a significant number of people in our community that are eligible for the scholarship.
I just wanted to say thanks for all your work. This is it's been a very thoughtful approach to really, I mean, at every leadership council meeting I've been at, it's been diving into the data, really trying to break out into groups and see what ideas emerge. And so you've really been trying to figure out, obviously you're aggressive on trying to raise those dollars to achieve that vision, but where can you really plug in and make a difference? And then recognizing that it's not just about filling out the FAFSA. It's got to be comprehensive, really looking at the mentoring, engaging students, and that having that pathway right into that good fit for their future. So it's really impressive. We'll look to see those lagging indicators as we go, but really strong data. Thank you.
Thank you so much for your investment in us. We will continue to be accountable to you. And if you have any questions, so.
Yeah, I think it's really, it was an investment. It was kind of a leap of faith because as you guys were just getting it all started, and I think it's proven out to be really effective. And so thank you for being good stewards, for doing all you're doing, for the needs of our community. I think that was one of the things with our AAP dollars. This was one of the ways we were getting to some of the youth in our community to really help drive a difference. And you guys have done a great job.
I would like to say that we have tremendous partners. There are tremendous nonprofits who are coming to join this, Big Brothers Big Sisters again. But you look at what Aspire is doing in Eastern Washington University and the program that they put with those peer mentors. Then you've got Gonzaga on the campus at North Central. It's amazing when you've got a high school kid who's connected to a college student in a way that's really showing what their future is. So
I think this is kind of the model of what we would have hoped would have happened with our homeless group in the past is you guys really took the lead and really are bringing everybody together and looking at how to make it work more efficiently and effective to get it out there. And so, taking that lead and not having it be about anything other than helping these kids, these families. So thank you.
thank you. Oops.
Okay, then that's going to take us to miscellaneous. I don't have to say these are not today, but we do.
One executive session pending and potential litigation, like the board, Scott, myself, and Deb are there. 10 minutes, no action.
And we do have a closed session, and that's what Commissioner's choice, probably 20 to 30 minutes. We could do it this morning, we could do it this afternoon, whichever you prefer. Okay, we've got folks on standby.
Okay, miscellaneous.
Yes, briefly. So on the communications front, we have 2 proclamations today coming up for CB and GPRET. I think we have some attendees from those as well. I'll get you the names and who's reading both of those.
Yeah, and who is reading them?
I mean, it's easier for me to let you read the proclamation than me, so.
You wanna read
if you'll read
CV?
I'll do Steve, I assume you want to do.
Okay, so we got both of
Sounds good.
those current.
I'll second both.
And we got a second.
Yay. You could help us out. Usually they list the names of all the athletes. If there are any unique pronunciations, any help with that is appreciated. Did they this time? I haven't seen it. I haven't seen it yet.
That's been
I
helpful.
think they inserted all the names for the G prep boys.
Usually they do, but if there's any unique pronunciations, helps for less embarrassment for us when we butcher the name.
There's the C.
Okay,
I will make a note of that.
all right.
And you have
Pronunciation.
you have the prep them already, Amber.
I could. I'm cheating.
Both are at the bar for signatures.
So that way you guys can just look through it.
Thank you. Check the names before we speak.
On the events front, a reminder that tomorrow is Liberty Lake ribbon cutting. We are working on sound system. Parks has something. I don't know for the commissioners that were at Bear Lake, if you had any feedback on the event. I thought it was very well attended. And that does mean that we need a little more amplification than kind of our karaoke machine mic that we purchased. So we will try and make some improvements there, but it's a wonderful park. I've been out seeing everything. For the commissioners able to make it tomorrow, it's gonna be a really nice visual on a good community event, I think. 2 weeks and a day from today, we will have the commissioning ceremony for the new sheriff's helicopter on June 4th that has arrived. And it will be commissioned in a ceremony at the hangar at Phelps Field. It's right next to the tactical unit, so should have that on your calendars. We're looking to still reschedule when it's ready, the event at Newman Lake. And so that's kind of what's coming up on the events front. I would mention we are gathering topics for the chair's State of the County address. So I'll send out an email later this week, a little tardy on that. But just topic ideas, we've got a really good, robust list going. There's a lot that we could highlight. It's gonna be a winnowing process. Chair decides to focus on. On the press front, we'll have a release going out for Memorial Day, announcing the closure. It's all county offices will be closed. The golf parks, the golf courses and some of the parks obviously will be open in the rec side. Let's see, I do have a draft release for the co-responder program. If the board's interested in that, I'd be happy to circulate it to the chair and then to the full board. So that's something that's desired, release on the co-responder. Okay, we've been highlighting those investments from opioid or MHST dollars. And then a couple of things on the press front. Got a request in about the flock cameras, so I sent that over to the sheriff's office. I think there's something on the agenda today about sites of 26 new cameras. And then we are getting media requests on, I think in follow up to the spokesman story on county reboots jail treatment strategy. And I know that was discussed in front of the board, but I'll work with the chair on fielding those requests. I think there's interest as things get flowing and council starts signing off on the task force. There will be an expectation we have something to say about the body of work that you all are going to undertake. So more to come on that, but just an FYI and a flag for you. Yesterday, there was also a press release that went out from Commissioner French's office. I saw you all should have seen it. I think there's at least 1 or 2 stories out there about it. It has to do with the federal funding and the tech hub. So right, the pullback, but I think Commissioner French's message was he's hopeful that his office and hopefully the board can help show the value to the administration and maybe get that money turned back on.
I know several of us, I got a call about the new updated Board of Health membership that was the updated statute. And I think you did too, Commissioner Kern, so there might be, you got, okay. So just wondering what the board or the health district was doing to start looking at the new requirements for board members. So I said, we're starting to look at it. And so there might be a story on that with the new tribal member participation. So, and then I got a call about the homeless ILA, so I went and called back on that. I haven't had, gosh, had a record long meeting yesterday. So I was gonna ask if we wanted to put out a news release about the new interlocal on regional homelessness, but it may be that they're already doing an article anyway, so. But
They already are.
we talked about it a couple weeks ago.
Yeah.
About doing a joint, and you thought, no, but maybe our own news release.
Yeah. Yeah, what are your thoughts? I think,
I think
I
there's
think everybody was doing it at different times, so that's why not doing
Did
a
the city
joint.
voting, did the city vote last night, maybe on it? I
I
don't
think
know.
the city's plan was to send a release out this morning or today. I haven't seen it yet. And if the board didn't want to send a release, if that's not the consensus, individual commissioner could send one. Or commissioner could still work with Aaron at the city to get something over if they haven't sent theirs out yet.
I believe it was on their agenda last week. The ILA, the cities. So I don't know whether they've asked or not.
I think Aaron told me it was scheduled last night and her intent was to send it this morning. But I haven't seen it yet, so I think it's in draft still. I mean, I haven't seen the final. I saw a draft.
Cause they had sent over a draft, wondering if we wanted to put a quote in that, okay.
Then we thanked them and declined.
Yes, we did at that point, just because we all didn't know when everyone's approving it and all of that at different times. And it's really, again, just an update other than adding the data sharing is really the new. It's what I don't want it to seem like is we're doing new and different things. We're just doing the same things we've been doing. So usually a press release to me is like, we're changing and updating, and doing new and different things. And I don't think we're really doing new and different things. We're still continuing to do the same work we did with the city of Spokane. So,
Yeah, I think there's a higher level of sharing data, there's a higher level of commitment to working together.
well, is there really a higher level of collaboration? Because they're still doing contracting with who they want to contract with in a manner that we may not have, agreed. Like the scattered sites is all, city of Spokane's ideas. That wasn't the county's part of that. So I mean, so that's where I'm struggling a little bit as to how we're, how we're higher collaborating with George here, versus we're continuing to invest in all the things we've always, invested in, and our investments through Salvation Army, through Catholic Charities, through BOA, they're making some of those investments less. So that's where I'm just not sure that it's, I don't want to give the public an impression that we're doing more than we're doing.
Well, yeah, from our staffs not meeting regularly, two of them meeting regularly, coordinating around the funding. We're still doing our own funding, but we're talking about what you're funding, what we're funding, so we're not duplicating funding. So I think, to me, it's a step forward.
Again, they've been meeting that for over a year. We just finally put it into writing.
Right, that
said
we're
they
committed to continue
keep-
doing that, no
they
matter.
keep meeting, but it's nothing new that they're doing. George, Gloria,
Right.
and Dawn have been meeting for over a year. Whatever.
I still, just my own trip opinion that, the ILA is a codification of that. And so then that's a vote of the board, it's a vote of those agencies, so it's not as significant as what you're talking about in terms of the total coordination of the funding strategies, but I do think it's a step towards greater collaboration, and I think that's good for the public to know. I think if communicated in the right way, it would lead to confusion, but that's just my take.
We can look to put one together and Because I mean, we signed ours last week.
Mhm.
So,
Yeah, happy to be involved too, since it's a board vote and helping field any of the media requests, if you want to handle it that way. One thought I was having on this and some of the other announcements looking for news hooks is a focus not on the process, but more on the results in terms of impact. Like the process can have an impact getting that collaboration, but if there's any upcoming proof in the pudding of where collaboration that we want to highlight and showcase a contract, not a ribbon cutting, but you know what I mean, something tangible, where we are coming together, like we're funding the same thing, or we're doing the same kinds of outreach. I know it's not in that bucket, but in my mind, the co-responder one is a kind of a clear like partnership one where there's going to be funding announced. And I tend to think when there's money involved, there's like a tangible asset, a facility, a piece of equipment, a program or something to show, then there's heightened interest from the media. But that's just some thoughts to consider.
I know it feels like we've been working on this stuff for a while, but I do think it's moving us in the right direction. I mean, we didn't have any data up a year ago or even 4 months ago. And now there's regularly updated homeless data on the SRHD website. And I think that's a good regional, and this agreement we just signed said that we will continue to report out the data and outcomes to the community. So there's a commitment to that, or a renewed commitment, if we want to say. But those things are important. I think the public wants to see what's happening, how the dollars are being spent, and having real outcomes in terms of housing people more quickly. So
I'm happy to put a draft together. There's 3 head nods.
I'm putting a draft together.
Okay. I'll get a draft and send it over. I think that's all from the communications bucket. One last thing I said yesterday, unless you all have feedback on the one pager for the APA, tomorrow, probably about noon. I haven't heard, just like to be able to move forward on that. So it's been reviewed by the executive team. The board's had kind of one once over and provided some feedback. But if you have anything specific, something we missed, or a word that we're hanging up on or something, just let me know.
Thank you. Thank you.
I've got. Pretty sure if you recall, about a year ago, last April, we passed a resolution making you aware and letting us put forward a request to the special master in the Monsanto settlement. If you recall, we got about 3.7 million in the TMDL distribution. And then there was a special needs part B related to stormwater that we're authorized to request from the special master. We put a $5 million request in there. That was the limit. And a couple of weeks ago, a check showed up for $2 million. So we just got a little $2 million win for our stormwater team. In that, we proposed obviously $5 million, most of it being equipment, sweepers and vectors, as well as outfall removals. So if the board is agreeable, our recommendation would be is that we use that $2 million funds for the equipment and get those sweepers and vectors. The outfall removals, we still plan to pursue, but now that we're at a GMA jail, we think we can get ecology dollars to support that, which is usually only a 20% match. So we would still pursue that work because it's good stuff. That's typically, they were the outfalls from our bridges typically that don't have appropriate treatment before our stormwater goes into some of our bodies of water. So really good candidates for ecology funding. So it would be a recommendation if the board was supportive to use this on equipment, because there's no way to find other money for equipment.
I'd be happy to, but can you give us kind of a list, breakdown as to, here's the $2 million and here's the equipment cost and here's how many pieces, just.
It would be 2 vector machines. Ours are toast at the end of life. Those run about $650,000 a piece.
Can you just give us a little sheet? summary sheet that would
Okay.
show on that for.
Two sweepers and two factors, and I'll get you the pricing on that and let you know.
I know what a sweeper is, I know what a vector machine, the other thing you said, Paul? or-
Outfall removal, so that's stormwater, and outfall is anytime you have a discharge, whether it's wastewater or stormwater into a body of water, it's called an outfall.
Okay.
So we have a couple locations on bridges around the county where the stormwater from the bridge is discharged into a body of water, Little Spokane, and Deep Creek. And so you just, the best practice for those is instead of directly discharging, you run it into a treatment swale so that any pollutants can be filtered out and treated before they seep back into the groundwater table or the body of water. Those are slam dunk ecology. Now that we can get ecology funding, those are slam dunks for ecology funding.
Thank you.
Happy to bring back we'll show you the equipment that we're considering and pricing and process.
Because partly, I mean, this helps offset as we look at the stormwater fees that were enacted. I kind of like to see kind of what that was initially with the, you know, how this is helping supplement that. So that would be great.
Absolutely. Good news. Free money.
I've got a quick one, or we have with the Monroe Court building, that existing tenants in the building, and some of them have come up on for renewal. They have lease extension terms in there. Most of it's kind of ministerial work. I've worked with with Matt's team. Any leasing requires the approval, leasing activity requires the approval of the board, leasing activities. If it's the board's desire, you could have a resolution prepared for myself or Jeff to be able to execute simple lease amendments to extend leases, just to save on the ministerial process. If it's a new lease or significantly modifying the terms, dollars, stuff like that, that would still come back to the board. So I wanted to, we've got a couple of them that are coming up right now. So if you want to see them individually and approve them individually, that's fine. If you would prefer to, by resolution, give me the ability to sign those, or Jeff the ability to sign the minor ones, that could also save on some time. And of course, I could provide you rent rolls and just continued updates on what the activities are in the building as well. So your guys' decision, decide it today or think about it and let me know.
I'm fine. Yeah, like it.
Awesome.
It'd be good to get updates on just kind of the plan for the use of the building as we go, but I think minor agreements would be fine.
Okay, all right, thank you.
And to that point, I know there was discussion about folks were spread out amongst floor 2 and 3, and there was a desire to maybe consolidate the non-county tenants kind of down to one floor to open up an entire floor for county use. Update on that?
Yeah, there, for the most part, all of our available space that we're currently got a project underway to look at locating the prosecutor's office there is on the 3rd floor. And that's where our open space is. 2nd floor, there's a little bit of open space down there. The only thing there's one tenant that we've got a provision in their lease agreement that we could relocate them on the from the 3rd floor if we want more contiguous space. So we've got flexibility and there's not a lot of, other than that move, there's probably not a lot of downward consolidation that's needed. Okay. So I think we're in a good spot. We learned, as we got to go through the building and see what's in there and what's available. One tenant is expired, their lease expires the end of June. And that's on the 3rd floor, and that's opening up some more contiguous space to allow us to look at the prosecutor's office. So I think we're in good shape, and that's moving forward. So I'll come back, I'll just put together a briefing in the upcoming couple of agendas where I'll just share with you the rent roll and available space, floor plans and things like that. And again, if you want to tour the building, happy to bring any of you over, arrange with Gil, if you want to just see it. Okay. So, exec session?
Yeah, she's not here.
Oh, yeah.
But if you just want to state the purpose for the record and who you'd like present and length of.
Yeah, I have one executive session, any potential litigation, the board commissioners, Scott Simmons, myself, 10 minutes.
And no action.
And no action.
Yeah. Then,
And then we'll have a closed session after that.
okay, so we will go into we'll give folks a couple minutes to clear the room. We will go into executive session at 11:15. At the conclusion of that executive session, we will adjourn until our 2 o'clock. And then we will, as stated, have the closed session. And we'll see everybody back at our 2 p.m. today.
Closed session.